implant to hairs, we are injecting patient own tissue. I will explain to you how to prepare. Hair loss can be seen in every patient problem, regardless of gender and age, and it's a worldwide problem, especially from the baldness around all men's problem nowadays. And it is a problem for men, also women. Maybe 50% of the men and 25% of women has a hair loss problem. And interestingly, hair loss problem in women is increasing. And before this technique, we also told our patients we have no solution to do for women, but I will show you how we have a good result with organ hair transplantation for women. There are many reasons to hair loss: genetic, endocrine, environment, nutritional, lifestyle, and skin and systemic diseases can cause hair loss. And it's a change for men and women. We try to understand what is their problem. It's caused to the hair loss. Before surgery, we do a blood test and try to understand their real problems. And main cause of hair loss in men is testosterone. And still, until now, we don't know what is the real cause of hair loss for men and women. And these are the basic treatments, as we know: minoxidil and fenestrate, and a variety of the unproven scientific events, formulations, and hair transplantation. That's two techniques now we call FOET or FOET. For women also is same treatment. We try to stop the hair loss. We try to help the patient. It can help some patients, but it doesn't work with some patients. I will describe to you a different approach to hair loss. We call leading cause of hair loss reduction of fat on the scalp. As we see, we have fat tissue every part of the body, even in the scalp. And why we lose the fat on the scalp? With age or gravity, bad nutrition, smoke, alcohol, or insufficient sleep, men and women lose fat around the scalp, including hair and skin. We see we have a fat and it has functions. It is very important to understand this. Even around here, around the road, we have fat tissue, and it's blood supplies to our hair follicle. Therefore, it's fat under the hair follicle is very important. These are the functions, as you see: protect hair growth, hosting dermal papilla, hosting vessels, nourishing hair cells, protect hair organs from mechanical damage, absorb strikes, and softening the dermis, allows dermal papilla cells to divide freely. As we see, it has many functions. Therefore, it's very important. What happens if the fat decreases? Fat decreases with age automatically. And if decrease, vessels suffer mechanical pressure, hair root cannot get sufficient nutrients, and dermal papilla cells reduce to mitosis. As we understand, it has a very important function. How we can understand we don't have fat tissue on our scalp when we can see that old people, and you can realize that the skin is very thin and it's shiny. It means that there is no fat and there is no water into the skin. And it means that we have not good environment for hair transplantation. If you do hair transplantation, you cannot have a result, or you will have a bad result. Therefore, we describe this technique. I will start to talk you about something that was derived stem cells. We already know what is this, and we use it a lot for many reasons. because adipose-derived stem cells are one of the latest breakthroughs into the field of medicine, and skin rejuvenation have very promising results. We are using in this aesthetic medicine, and we have a wonderful result. We know what is this. And when you prepare the adipose-derived stem cells and inject, and they release many growth factors, about 7 growth factors, and they have different functions, and they really work and help us to healing. Adipose-derived stem cells have great potential nourishing the transparent area, block apoptosis, promote angiogenesis, reduce inflammation, promote neurogenesis, differentiate to the Denmark papilla cells. It's known, there are many works in the world about this, adipose-derived stem cells. And I showed you yesterday, when you inject stem cells with fat onto the skin, any areas, we have a great result. Even for scars, I have a technique for scar removal. We inject the stem cell and rich fat under the skull, or pigmentation problem. If you inject stem cell and rich fat under the pigmented area, you can have you can see the change. And we described the organic hair transplantation, and it is ready to publish because until now we have 1,100 patients. I told you about adipose-derived stem cell injection for hair regeneration. You see, already published, Dr. Fukako from Japan. As we see, treatment using adipose-derived stem cell condition medium appears highly effective for alopecia and may present a new avenue of the therapy for hair regeneration. There are many publications about the adipose-derived stem cell injection for hair loss. But when you inject even PRP, you know, it is worldwide known treatment for hair loss. But this is a temporary treatment. I will show our technique. You will see that we will inject a solution, special solution, include stem cells and fat together. Therefore, after patient healed, we build a mechanism. It's automatically release a stem cell, how much patient needs. Yes, this is the animation video I did for you to understand how it works. As we see here, we should have fat tissue next to the hair follicle, and we take 2 strings of fat, one for adipose-derived stem cells, one for fat graft, around 50 cc. I will show you all details and videos together. And this is for stem cells preparation, and this one is ready for fat. And then after finish, we mix some parts of. I will show you all details again later. And when we inject this cell-enriched fat tissue next to the hair follicle, as you see, they start to produce and release the growth factors. Not only injecting them, always they produce growth factor and helps to the healing. And our aim to make a healthy skin into the scalp area. It's very important to have healthy skin. If you have healthy skin like baby, you cannot have skin problems, like pigmentation or the dryness or hair loss also. Therefore, as we see here, we try to make a cell-enriched injection here, and it makes regeneration and blood supply here, and blood supply helps to grow new hairs. Because in this work we did 102 male patients only from 2013 to 2015, and this system I will show you. I developed this technique 15 years before Sihantimur fat transfer, and I use for this for all kind of fat transfer, for face, for breast, for every part. And same time, this is a hair transplantation. Same time, we transfer around 3,000 to 4,000 follicular units for each patient. You know, before hair transplantation, we should inject a solution to the scalp. It includes chemical and adrenaline and something more, and it means that they will kill your hair follicles. But we need energy. I will show you. We need that help to hair follicles for survival, and this supplies this help. As I told you, we take around 100 cc fat total, and I use this device as Dr. reminded us yesterday, laser, special laser. And I use this one, its name is lipomatic, and they call nutritional infrasonic liposarcos. It is, in my hands, I'm using this technique 2003. It is a really magic device for to liposuction. What is effect? It makes a nutritional movement inside to the fat tissue. You see, this is not normal cannula. Cannula is moving like this automatically with vibro energy, which they call vibroliposuction. Helps to obtain fat tissue with less damage, allowing the stem cell to get extracted from the wall of adipocytes. Now it will be more popular in the world because they call this mechanic digestion without enzyme, and we can have some stem cells. And somebody published this, as you see here, and as a conclusion, regeneration cells can be isolated from lipoaspirate, and the salt or normal liposuction or the vibroliposuction, although the lower quantities from the enzyme digestion yield, the vibroliposuction help us to get 3 times more adipose derived stem cells without any enzyme digestion. And therefore we use this device for start. And when we have fat, we prepare a special nourishing formula, because the first time when we inject fat, it is very important to survival in early post-operative. Therefore, we mix this nourishing formula. There's adenosine, glutathione, and nicotinamide, and there are many things inside to mix fat. And then the other part, there is another device we call lipokit, because it has a special designed syringe. It looks like a syringe, but it is very well designed syringe. There is a metal inside. It's about 25 grams. But when you start to centrifuge, it affects like 90 kilogram. 90 kilogram press on your fat tissue, and therefore you have fused fat, pure fat. And we put 50 cc of lipo material to the lipokit centrifuge. After having centrifuge procedure, stem cell enriched fat part is obtained, and then vibrolipo, special nourishing solution, and lipokit centrifuge fat. When it's always combined, mixed, we have a special solution for injection, and we call this Sihantimur fat transfer. And you can see the procedure here, video. Yes, this is lipomatic, you see. We start and collect the fat in these bottles. And it is very good device. You don't need to push your hands. It can do automatically. And this is lipokit centrifuge, as you see, lipokit syringe. And we prepare also every time PRP, also mixing PRP2. And when you are surgeons still doing lipo, nurse can prepare your fat, because it takes 30 to 40 minutes. It is very important to the injection time for fat tissue. We try to inject in 30 minutes. Don't wait a lot. As we you see, this is the lipoid syringe. This is triple set. Only this system supplies us to have this. And it is squeeze back, as I told you, we press around 90 kilograms, therefore there is no water inside your fat tissue. And when we have this, we inject this one, this part, with this part mixing with around 10 cc nourishing formula and 5 cc stem cells and 1 cc, 2 cc. I will show you later. The patient is ready, we are ready. Let's start. I will show you step by step how we do. This is what we need, a special bottle to collect your fats, and 2 lipotic syringe, and this is lipotic device, and 2-3 syringe, and hole maker, and our cannulas. We do a little local anesthesia before making a hole, and this is a punch, as dermatologists used usually, because we try a 2 millimeters small hole, and you don't need a stitch and no scar. And we inject around 200 cc Regeniratide and 1 milligram adrenaline. We prepare always two tubes of PRP, and we get around 4 cc PRP. And after lipo, as you see, we aim to have 100 cc lipo aspirate, as you see. Total is 100 cc or 200 maximum. Totally closed system is very important in my opinion. You have a closed system and quick transfer. And donor area, you don't need bandage and nothing, just make it plaster on it. And we take all fluids out, around 50 cc excess fluids we have, just right after the lipo. And we see there is our fat tissue here. And mostly the surgeons in the work, they try to inject this one. But there is still water inside, I will show you now, around 50%. We take the fat tissue from here to go automatically to go inside this syringe. It's closed like a syringe. As you see, it is ready, 50 cc, 50 cc, and 50 cc motor. It looks, after this, it looks like we have 100 cc fat and 50 cc water, but it's not, I will show you. And we put this lipotic centrifuge, we call condensate fat containing injection centrifuge at 3,200 G, 8 minutes, not 5 minutes. We try to have concentrated fat for scalp. Okay, you can see, after centrifuge, you see, only half is fat. Others is still water. And as a result, we have only 50 cc fat and 100 cc water for transfer. We take this water also out, and we take our PRP. And also, this lipotic syringe give us that, as I showed you before, mechanic digestion stem cells, and they are coming to the end part of the syringe. Therefore, we take 1 cc of this, because there is stem cells inside. Mechanic digestion stem cells here. We take this and put here ready. And this is our PRP, and this is our fat here. They are all ready. And if you see around, they are all mixed before transfer. And ready to injection. As you see, this is not fat alone, not stem cell alone, but a mixed solution. And we have this device, I say here, wall maker, is blunt type, and just open 1 millimeter hole no need to stitch. And even this one, we try to hidden inside the skull. Because when I start to make hole here, patients complaining about this also. And I start to make here and inject hole here. This is the injection method that you asked yesterday. Many people ask me which level we are injecting. We try to inject next to the hair follicle, but we are not sure. But it is very difficult to inject, you can understand from here, very hard tissue. If patient have hair transplantation before, normal hair transplantation, they have a scar tissue, therefore it is more difficult. But if you feel very easy injected, it means you are under Galea but we don't need to inject that. Okay. Otherwise, we take around 225 or 30 cc fats. One is for fat preparation, I already did and inject, and the other one, as you see, still have. We will use this one for stem cell preparation with enzyme. We use lecithin, 5 cc lecithin, 20 cc serum physiologic, and 25 cc our other fat, as you see. And we mix all fat, serum physiologic, and lecithin, and put all into this device for enzyme digestion, and stays here around 20 minutes, 38 centigrade. After incubator, I remember the incubator is very important. As you see, enzyme broke all fat cells, and this fat cells is died. We take all out. This video, can you play the video? I think this video. Yes. We try to take fat out, and we broke the fat cells, and we released the stem cells here inside to our solution. But as you see, fats came here. It's rubbish, we will take out our stem cells here. And we put an enzyme inside our tissue, therefore we need to wash. Generally, we wash 2 to 3 times. This is a washing method, washing. And put more serum physiology, about 25 cc, and centrifuge. Again 2 or 3 times the centrifuge. And after finish everything, we have around 5 to 10 cc solution. It includes our stem cells. And we try to check before injection, we have already stem cells or not. And we use this system from Korea, lunar stem. It just can help you to show the nucleated cell. We don't know really we have adipose derived stem cells or not, but it just gives an idea, because we are doing all this in operating theater in 30 to 45 minutes, and we don't need to laboratory, or we don't want to inject in IV. What is the advantages? There are many advantages: higher viability rate of collected cells, closed system, no contamination, concentrated young and healthy adipocytes and stem cells, shorter transfer time in around 30 minutes, all advantages of the stem cells, fast recovery, all procedures are performed under surgical conditions. Patient doesn't feel any pain, scar tissue is improved. In this hair transplantation technique, we should take the patient to operating theater before fat preparation. Therefore, under anesthesia, we do all injections. Patients don't feel any pain. Even after surgery, they feel sleepy around 3 to 4 hours. And I forgot to tell you this stem cell part, which I prepared. We inject like mesotherapy. Therefore, we are sure we inject our solution all level of the scar tissue. You see, FMA patients, they have many in Turkey looking for solution to their hair loss and hair transplantation. Before this technique, we never touched the ladies, but now we do. And you see, we have great results. Because our aim, we call our patients, we will transfer out 3,000 to 4,000 follicles to you, but also this solution will help your own hairs also. They will grow also. They will be more healthy also, and you will see results more than expected. Another patient, as you see, that you can see that the hairs also looks healthy, fresh. Another one, you see, female complaining about hair loss. For female, we inject everywhere. For male, we inject only where we do hair transplantation. Can you see the result? And for men, you see, we did 3,000 hairs transplantation, but it looks maybe 10,000. Another one. Also, if you can realize there is no any scar tissue, you cannot notice they did a hair transplantation because of the stem cells. And healing time and pain is at minimum 4 times less than normal procedures.
Is this the same result for patients with true alopecia?
Yes. Can you explain?
Is there the same result of the technique with patients that have true alopecia?
True alopecia.
Alopecia. No hair.
No. No, we need hair.
They have to have follicles.
Yes. Otherwise, we cannot transplant. Another patient. Another one. You can see the front line. Even hairdressers cannot notice the hair transplantation. It's very important. When you do the normal hair transplantation, they have scar under the skin, and therefore they feel and pain when they touch. But in this tissue is quality is very good and soft, and they have no pain. You see, they grow very well, very well. Another one, and another one. Very healthy, also very healthy. And this is the first case I did. I tried on this guy first, and we wait 2 years how it affects. As you see, hair loss here, and this hair, this very good looking hair is mine. This one. I have a video of experience of him, but there is no voice. Just you can see 1 minute how he feels. You see the hairs. Very good. And also they grow very quickly. It comes around 6 to 8 months, we see before and now. All hairs. And if they have a hair loss problem also, it helps to stop hair loss in some patients, not all, we cannot say. You understand this before I showed you. After injection, it comes and our solution helps to release the stem cells around the hair follicle, and then you see they have to grow with the new hairs. Thank you very much.
Thank you very much for your presentation. Some
Yeah,
questions?
What is this? What age?
Very good question. If patient is young and healthy skin, we don't recommend normal hair transplantation. They can do it. Do you understand?
Well, if they have hair.
Excuse me,
No.
can you use a microphone?
If they have hair, but they're older and they have decreased hair,
Yes.
but they have hair,
Yes.
what's the oldest that you have done?
If they have hair, the two types of patient, they have problem with hair loss. they are asking that I want to stop hair loss, we inject. But if patient is young and looking for hair transplantation, we don't recommend. We say you already have a healthy skin, no need injection. We can do normal hair transplantation for you. If there is no good skin condition, we need to improve the skin quality, therefore we inject this. Otherwise, and for women, we recommend first we inject, wait 6 months, and then still they have problem, we do hair transplantation.
You will need any serial injections, just only one session?
Yes, just one session. But if they are looking for it, you can do PRP. This is the advantages. You know, the stem cell injection, PRP injection already have many works. This is the advantages. When you inject one, you don't need to repeat it because it helps to have a healthy skin.
Thank you.
And doctors also already speak about same procedures. Is that this idea is coming when I talked about this 2 years before in Paris when I thought there was a congress about fat transfer and stem cells. Many doctors say, oh, I was thinking the same about this bit. Because it's coming now, many works I heard from my colleagues that they are working on the stem cell injection to the hair follicles.
I will talk later after my experience with face fat grafting for baldness. And you have good results. I think I have many ways to reach good results. I try to make easy my life and the life of my patients. I make this technique developed as called as one-step technique. I make a lot of tests to know what I am harvesting, what I'm injecting, and what I observe is that we must preserve all the elements under the skin, in the subcutaneous tissue, because there are all the elements necessary for regenerative medicine. So in the technique, like you use the conventional liposuction or the lipo, do you decant? You use a lot of infiltration, wet or super wet or tumescent technique. And it doesn't mean that you dissolve and you eliminate some elements necessary for the regeneration. Then you centrifuge, you continue eliminate. And for example, Tonar and Rapel describe the intersyringe technique to diminish and to facilitate the fat graft. And what are they doing is destroying all the cells. So they are injecting only for growth factors.
Yes.
And I believe that we must conserve and preserve all the things under the skin.
Yes. This is where the idea about fat transfer is changing all over the world now. Before we try to tell we should be very careful, very kind, to don't destroy the fat cells. Now we think we should destroy all fat cells. And we will have a young, small adipocyte and adipose thereby stem cell together. When you inject, they will grow and they will have a new fat cells.
This is the theory that Kotaro Yoshimura described.
Yes.
That it takes 3 or 5 months to obtain new adipocytes. But with our technique, like I explained yesterday, we don't destroy the adipocytes. They are preserved by this laser emission energy. And in 2 months, we have no more inflammation. So it's a little difference.
I would like maybe to make a little comment into this, because very much when you inject lipocells, stem cells, no matter what, much as the cells are going to die. And actually, you know, angiogenesis or cellular angiogenesis will come out for the tissue living. Now, many of the cells that you put goes into apoptosis. And personally, I believe more in the revert to apoptosis or retracted apoptosis. Why? Because in apoptosis, when the cells die, they have the genetic DNA. And then they comes with new factors. And that's new factor that allows things to grow or not to grow as expected. And probably what you're doing, you are putting probably factors that we we improve the angiogenesis, because even in angiogenesis we have the pseudo-angiogenesis and the true angiogenesis. Pseudo-angiogenesis giving more veins than arteries, and the true angiogenesis giving actually a better artery nutrition. Yeah. So it will be very important, probably that's in the future that we're coming out with this, to work it out not only that in the tissue, because really whatever you inject is going to, in some way, to die. And this is the new factors that actually will make this to grow.
And many bodybuilders came to us because when this technique is popularized, and as you know, they have zero fat. And we told them we cannot apply to this technique because you have no fat. And then when we do the normal hair transplantation, we can realize that everything in two kind of patients. Patients have fat or not. And our patients feel well and better results. And gives them patient after this technique, patient's satisfaction rate is more than 99%. It's very important. Because in the aesthetic surgery, we are trying to make patients happy. Patients happy, doctor will be happy.
I would like to just make a last comment. I am working in the area of Newport Beach, Orange County, and in the clinic that we work at, many plastic surgeons, we are about 8, and there is an anesthetist. And one time they came one of his friends, and he said, you know, I have my hair done by Dr. Sihantimur, and everybody came to look at it. I don't believe it. I said, how did he does? And then when an anesthetist would say, I'm going to go to Turkey to have my hair done, and really, it was a wonderful work done. And thank you.